summit, so we can then, with the year and delay, still give you an embrace and thank you for your artwork on this cause. So I think, Laurie, if you want to say something at the start, and we can go ahead with the starting presentations.
Well, I'd just like to say welcome to everyone here today, and it's really exciting to see this innovative conference once again, and hear about all of the exciting things that are happening and could be happening, and so it's very exciting. So welcome everyone, and I'm looking forward to this panel of presentations.
Absolutely, Laurie. It will be exciting to see what we'll have here to share. So, Ana Catarina Gomes, she's the founder and CEO of CBR Genomics. For many of us, me included, genomics, I know that it's something that it's going to revolutionize the way health and healthcare is being provided. But we will be enlightened by Anna's presentation right now. So, Anna, the floor is yours. I hope that you can keep the strict minutes, because otherwise we lose the time to do a little bit of sharing.
Thank you. I absolutely will do my best. And first of all, I'd like to thank for the opportunity to be here and to share our work with you today. And actually our vision about data, it's not there. How can I, so something is happening. So while this is set up, this is being set up and time is not picking yet, what I'd like to present you is on how genomic data should and must be also considered within the all healthcare data in the systems, and how these could actually revolutionize healthcare. So it looks like, yes, it's there now, okay. So that's why I titled that the healthcare evolution or revolution. So when we think about healthcare data, we have, this is no news for you, we have public data and we have cost and utilization data, which you can integrate and you can take, it's kind of public data in a way. And people like everyone of us in near this room can have a look and make actually policy decisions on that. Then we go to another sphere, a more personalized and protected data sphere, where we have patient-generated data, for instance, as those from wearables. And then as we go deeper and with more intensity, with more individualization and more privacy on it, we have clinical data. What I'm trying to focus on is on a very dark spot on this type of data, which is genomic data and genetic data. This actually is and should be very, very highly protected data, that it's where security goes far beyond just the privacy issues, because this is a very unique type of data. And this is exactly this black spot, this black hole is exactly where at CBR Genomics we are looking at. So when you talk about genetic data, most of the times people associate that with huge ethical issues and just turn their faces around and don't face them. So at CBR Genomics, we choose to look straightful and acknowledge the elephant in the room. And what is this? Is the knowledge that 1 in every 10 children has a mutation that causes unactionable pediatric diseases. The sooner you know about it, the sooner you can start treatment. In adults, 1 in every 6 people has a personal risk for unactionable monogenic diseases. Again, the sooner you acknowledge that, the sooner you can start treatment and manage disease. And for instance, when you talk about cancers, 1 in every 10 cancers, they are hereditary. This means that 1 in 10 could actually have been prevented and lives could have been saved. So not all cancers are hereditary. Genetic causes only 1 in every 10. And actually this one is the ones that we must be saving as soon as possible. And with this in mind, for us at CBR Genomics, to all our team, for us, doing nothing was not an option. Because we believe that the only option is knowing. It should be, it must be the only option. And so we have developed this DNA-centered healthcare approach to define the best monitoring plan, to select the most adequate treatment, and to have access to the genetic therapies. We believe in an ubiquitous DNA usage within clinical practice. Actually, I've just noticed that this is not the most recent version of my presentation, so that's why. But anyway, so just as we have today ubiquitous computation in all our pockets, we think that DNA should be ubiquitously within the clinical desk. And this is not only us saying, the most recent studies also say that. So there are already studies on the use of genome and whole genome and exome sequencing in newborn screening to tackle that problem of 1 in every 10 children as a mutation. Also, the American guidelines have already decided and showed that, for instance, in some type of diseases, genetic approach should be the first tier. So with this in mind, we have developed a unique service where from a simple saliva sample, we can extract DNA and we can screen for actionable diseases. We have built up these DNA files baby and DNA files in the intellectual disabilities as the first screening tests for babies. And we do that building on a proprietary operative system where we can manage, which has been patented, and where we can manage control data access, secure data storage, and completely anonymization in a way that actually the patient is the one that is the owner of the data, has the empower to say which doctor has access and when to their data, but don't actually see the data. So, and I wanted to ask for your attention, especially when we're talking about this thing here about the access to genetic therapies. It is my knowledge, this is the way for the future. The slides that are missing were those one here, that's saying that nowadays 7 gene therapies have already been accepted and implemented and approved. But on the pipeline, over 300 genetic therapies are on preclinical stage. This means that in 10 years, lots of new genetic therapies will be present and available. And this is going to change dramatically the way healthcare systems are, because these therapies are very, very expensive. These are going to put and to bring a burden on health systems. Also, they have the most effect the sooner they are applied, and this raises the awareness and the need for very early detection systems. And that's actually why here I have shown you and demonstrated you that genetic data can actually today, even though today it is a black spot within all the data because all of us are looking for all those other types of data, this has a huge impact on the individual as it can save lives as of immediately as any genetic disease is detected, but also it has a strong impact on health policy because we need to know how many people have the mutations to access the economics of these new genomic therapies. And these are going definitely to bring a huge burden to the systems and for the paying systems. So I'm sorry for being skipping, but I really wanted to leave and finish with this last message of the importance of genetic systems, genetic data for a better health and for a more sustainable health systems. So my challenge to you is, are you ready to break the genetic boundaries? Start to look at the challenges straight now, and start to work with us on delivering more and faster genomic screenings, and then so that this is going to be the starting point for the next generation of health systems. Thank you for your attention.
Thank you so much, Anna Katerina. Well, give me the spook to think about how strategically how this can be for healthcare systems of next generation, and I'm sure we are taking notes here. Okay, so the next presentation will be from Ansel Trolix. He's the director of business development. Better, it's a company that I have met when I was in Slovenia in the Health Day initiative by my dear friend Gregor Kusak and also our event manager Uska Rauter. They did this precious week in Slovenia, and I saw Ange's presentation. I said, perhaps this is the future, and absolutely, Ange will tell us a little bit more about open HR and how this can be revolutionary. Over to you, Ange.
Thank you, Paul. Great to be with everyone, everyone who's there in presence and remotely. Good to be part of this conference, and thank you for extending the invitation. So without further ado, let me share my screen. Right. What I would like to talk to you about and present today is why we at Better believe that data is actually a really important asset and aspect in healthcare today more than ever. What roles do digital health platforms play in removing the barrier to innovation in healthcare, and why data should be stored separately from any applications in healthcare so that it can be kept for the lifetime of a patient and accessible to everyone in the wider ecosystem in healthcare, even outside of traditional healthcare settings, under obviously security and safety rules. So today, what we observe is that care is shifting from hospitals to communities and home. Citizens, on the other side, want to be even more engaged in managing their health. They want to become an active partner working with different healthcare teams. And they would like, or we would like, more and more access to our own healthcare record and be able to decide and track actively what's going on with us. We would all, these are all the trends that I'm sure everyone observed in the last couple of years or even a decade. But what happened during COVID is that these trends towards new models of care, towards remote, towards us as individuals and patients being more engaged in our care, solutions came to be, along with new models of care. However, what became really clear is that healthcare, more than ever, needed a full and easy access to all the patient data in each step of the care. On the other side, if we look at the EHR solutions, the current ones that are used are often causing a lot of stress and to a strong physician burnout charts. Gartner seek EHR solutions that are in place, especially from the perspective that they're usually very rigid, very slow to change and respond to new situations or new regulatory requirements, or even new ideas from medical teams, and move and support quickly the new models of care. If we look on the regional level, the challenge of having several systems working nicely together and sharing the data is even bigger. Jordi Piera Jimenez, who's the director of the Digital Health Strategy Office at Catalan Health Service, put it really nicely. He said that Catalonia has been struggling to make data follow the patient for 25 years, and it seems that interoperability is just not working, and they would like to go with a fundamentally different approach, an approach which is based on data, data level integration, where apps integrate on a data layer and no longer app to app. And the whole Catalonia now decided to pursue this approach. What this shows is that more than ever, healthcare really needs quality data for point of care, diagnostics, different secondary use cases, and so on. Rachel Damscombe from CEO NHS Digital Academy put it really nicely. She said that data is for life, not just the principle. We will start to design and procure systems differently in healthcare. Monolith solutions who try to integrate and interoperate towards a new digital ecosystem. And the first step to do that is to hide these monolith solutions behind APIs and enhance them with a digital health platform or a data repository where all of these systems start to connect on a data layer. And this can be done quickly within 6 months to 1 year. And then slowly this will enable the move towards a fully data-driven or open data digital health ecosystems that will then remove the barrier to innovation and be much faster to include different new solutions and create very flexible environment of digital solutions for different levels of care. Gartner is recognizing a similar trend, emphasizing the importance of having data separated from the applications and building such ecosystems. And the concept that I explained is actually not new, because in healthcare, a vendor-neutral archive is already set up for images and documents, and the same approach now needs to happen for structured clinical data. And Open EHR as an open specification and standard with a growing community globally is actually a really good standard that supports that concept where data is separated from applications. Open EHR has today a big community with more than 100 countries participating, 1,500 clinicians who are modeling the clinical concepts, and a lot of clinical concepts which are already available. Healthcare today really needs an environment when it comes to digitalizations, which will help accelerate the digital transformation, simplify the work of medical teams, and make sure that data is really accessible for the lifetime of the patient to all the stakeholders. And the core foundation to achieve that is a digital health platform, which then supports the creation of such a unified care record, which is built around the patient, not institution, and not a single software. So one patient, one record concept. It then supports the full governance of data models, big choice of apps from multiple vendors, and all together fuel the creation of ecosystems of different apps from different vendors, which are built once and then put together to support quickly new models of care. So if you ask yourself, how do you start with this approach in the existing landscape, which you have within a hospital setting with multiple disconnected applications, it's actually quite simple. You set up a digital health platform like what we've done at Better with several regions and countries. And hospitals. You start with a single simple use case and enhance the existing landscape. And then slowly you start adding more and more applications and more use cases to the ecosystem. But the main idea here is that the ecosystem is built on top of a common data layer where data is separated from the applications. And eventually you will get rid of these disconnected and fragmented apps, which each have their own data store. With a comprehensive and vibrant ecosystem built on a vendor-neutral data layer where everyone has controlled, secure access to data for different use cases. Now, the same level or the same principles would also apply on the regional level, where you can then easily start connecting different healthcare institutions or even institutions out of the traditional healthcare settings. And because the integration happens on a data layer, data starts flowing much simply. The integration simplifies and you end up with a regional ecosystem and a virtual personal health record. And there's different choices of how you can deploy this. There's already several cases where this has been achieved. The biggest case is actually a citywide EHR record in city of Moscow, who've built and more than 500 institutions, and they're using Open EHR and Better's digital health platform to achieve that. Germany, 9 of the biggest university medical centers are using such an approach to gather data in a vendor-neutral format to then use it for research, different research purposes, but they have a single cleaned up structured data repository. Or for leading Nordic EHR vendors use OpenEHR for their next generation of EHR systems, which enable them to be much faster at what they do and give full governance of data in the hands of healthcare professionals. I mentioned Catalonia, who've decided to use OpenEHR and a digital health platform approach for the whole region. And in UK, there's some examples from hospitals like Oxford NHS Foundation Trust, Christie's, who are the biggest oncology center in Europe, are using this approach to cover different sort of activities record, no matter what are the use cases, either the clinical forms, prompts, core, or even research, which brings huge benefits. And then on the regional level, an example is Wales, which decided to use OpenEHR to support cancer treatment repository for the whole Wales and set up a shared medication service. While London is a region in London, which is building a dynamic care integrated care planning service based on OpenEHR, and it will help the countries like Slovenia and Malta, who build their national health projects, care records on such a digital health platform. We at Beta, for some time now, we're present in 16 markets. We've come to an ecosystem where where partners develop more than 50 applications built on a better platform, building a digital health ecosystems based on open data approach in different countries, and more than 1,000 healthcare providers. And these ecosystems store clinical data in a structured form of more than 20 million patients. We've been also recognized with our approach and the solution alongside of some other big companies by Gartner earlier this year. So just to sum up, the new normal for healthcare is all around having data stored separately from the applications for the lifetime of a patient. Monolithic EHRs are impeding the digital transformation. We need to come to an environment where data will be stored for life. And digital health platforms will play an important role because they will offer a more personalized user experience along with low-code tools for accelerated digitalization and a vendor-neutral data layer. OpenEHR as an open specification with a growing community will offer then a very robust environment where healthcare data can be governed by healthcare professionals and not vendors. Well, the future is bright, and we believe that better data will lead to better care. Thank you very much.
Round of applause. So OpenEHR is the way, and Better is really cutting edge, making innovation use of that. Marco Bego from Brazil. We had already the pleasure to have a presentation from CEO Antonio Pereira was delivering in the opening session. And now I'm sure Marco is going to further expand in English, right, Marco?
Yes, Paulo.
Okay. So floor is yours.
Thank you. Thank you for having me. Thank you for the invitation. Paulo, first of all, I'd like to congratulate you for organizing this successful event and greet the other participants of this panel and the audience. Thanks so much. Paulo, I will make a short presentation about the Nova HC and then Bruno will present our artificial intelligence lab here in São Paulo. I will share my screen. Just a second. As José said in the beginning, HC is the largest hospital in Latin America. It has 75 years or 77 years of activity. Here in HC, we have 80 specialized institutes such as radiology, cancer, heart disease, pediatrics, and others. And the important thing we have more 66 research labs and more than 200 research lines in the medical fields. And the Hospital das Clínicas works based on 4 pillars. One of them is assistance that is connected to the state of São Paulo. And education and research, we are connected to the University of São Paulo Medical School, USP. And the innovation area since in 2017, that where we call Inova HC. When I'm working, I'm responsible for the executive director of this area. And Inova HC was built for the development of an innovation ecosystem in health. It's an open innovation program, which runs the innovation to inside to outside the HC and vice versa. And we focus on, that's the idea, we focus on using innovation to solve complex problems and transfer scientific, technological, and cultural knowledge for the system and the health system in Brazil. And the last year, we have managed to connect more than 7 to 80 startups in our ecosystem. We have collaboration agreement inside and outside Brazil, and a project with private and public partners, and with various specialties, some of projects both together. And before going any further, I would like to just add something. In Brazil, you have many advances and also many opportunities in digital health and data. Here in this chart is a graphic summary done by the Collision Health Institute here in Brazil. And as an example, the opportunity that you have for the technology, we use technology a lot here, but we're still using them to automate existing service, but not to solve the major healthcare problems in Brazil. Brazil is a huge country, and there is some Brazilian regions that is still necessary to improve the IT infrastructure to leverage the adoption of digital health solutions. And healthcare professionals, we did a research here inside the University of São Paulo and the other doctors here in São Paulo, and this professional recognized the potential of digital health, but they not yet feel qualified to take advantage of the digital solutions. And we have a low use of big data and analytics, and a few innovative models in healthcare. And these obstacles could be opportunities. For example, prioritize digital health actions plans linked to the greatest problems in healthcare in Brazil has a huge opportunity. We need to create a solid technological base to leverage this development of the digital and data in health. Training qualification of health professionals in digital skills, and the most important for us that we are working move forward to foster an ecosystem of digital health in innovation and data innovation, create a secure environment to test, approve, and scale new solutions and service. With these landscapes, for example, Inova HC is an open innovation program, as I said, and we have an approach of always working with the innovation ecosystem. This is a picture. This our innovation ecosystem here in São Paulo is a huge one with many opportunities. And we always use a design approach focused on technology transfer. And therefore, we need for a modular design that can be used by the most hospitals and clinics, and also that it can be implemented by the opportunity without the need to digitize the entire system, but modules that can be integrated in the future. That's our approach, and help some of these verticals to the ecosystem work well using and help the digital health and using the data health here in Brazil. Finally, I just would like to close by saying that we aim to create and co-create innovative and scale health solutions for us in Brazil and other countries. And for that, Nova HC is always seeking partnerships with startups, governments, universities, and companies who are interested in working in an ecosystem scale healthcare problems. Bruno, if you can introduce yourself and continue present our artificial intelligence
sure,
lab.
here. Can you share the screen again, Marco, please?
Oops.
Yeah, I think it stopped. Yeah, the next slide, please.
Bruno, I think I have small problem here.
Okay, I can. No, it's okay. If you want, I can share my screen.
You can share, Bruno.
Yeah.
You can share.
Just a second, everyone. So, can you see my screen here? Yeah.
Yes.
So, hello, everyone. My name is Bruno. As Marco mentioned, at the late last year, we launched Nova HC's AI lab, which is called InLab. Our main goal here is to create structures that allow for AI to emerge. And in order for us to do so, we are working now in three areas, three specific areas. The first one is infrastructure and data, in which we try to provide health data to internal and external partners with security, quality, and efficiency. The second one is aimed at the machine learning side of things. And in here, we apply machine learning algorithms to solve those healthcare problems. And the third one is the integration side of things, I would say. And in that area in specific, we test and we try to validate those AI solutions in a hospital setting. Oh, let me just, I'm sorry, present it. It wasn't presenting. And then, as Marco mentioned, we work alongside a variety of partners, being them enterprises, those big enterprises, government, academic institutions, health techs, to solve the ecosystem's most pressing issues. And I would like to highlight here 4 of the projects that we have now. The first one is a project that for the few past months, we are working with Siemens. It's the idea of this project, this first one, is to develop a structure that allows for those AI systems to be developed using data from a variety of other hospitals. The second one is a project that we are doing with the Center for the Fourth Industrial Revolution here in Brazil. The idea here is to create guidelines that allow for the government to buy those AI solutions in a more sustainable way. The third one is a project that we're doing in a more internal way with our scientific partners here at the Faculty of Medicine. And the idea of this one in specific is to make sure that the patient does not need to have two exams because the first one had a bad positioning. So the idea here is to enhance those positionings of those image exams and to make sure that the patient does not have to come back again and do it twice. And the fourth one is a project that we're doing with a Brazilian startup. And the idea here is to use those natural language processing algorithms to track the severity of the COVID-19 patients that we have here. And then in that way, we can make sure that we know exactly what our patients have during a larger timeline, and to make sure that we can see if, for example, a third or a fourth wave is coming to our city or hospital. And so that's it. I tried to keep it really brief here, just to make sure that I can get a complete picture of a few of those projects that we have. And as Marcos said, it's really important for us to work alongside those partners, being startups, companies, the government, or other academic institutions here in Brazil or in Europe or or elsewhere. So yeah, that's it. Thank you, everyone, and I hope I didn't pass my time.
Thank you very much. Thank you
Thank
so
you.
much. And it's really great to see such an innovative organization as your hospital, because you're really making like an enzymatic influence in Brazil, I am sure. And this is also something that have made you proud, and certainly why you are also a global shaper, because it's the private-public integration. It's the fact that the public organization has the agility and dare to partner with private companies and to have these kinds of collaborations. This is the future. Thank you for your presentation, and
Thank you, Paul.
very good that you are going global shaper recognition in this Health Data Forum Global Hybrid Summit 2021. Thank you. Dear viewers, I see that there's already some questions in the chat from Dr. George Matthews is already putting some questions. Hopefully we have time to address them. Okay, so that's now Dr. Stephen McFeely and Steve that are remotely. Over to you to present and share yourselves your part of this presentation. You have here if you need to do slides, the floor is yours.
Thank you, Paul. So it's my great pleasure, along with my co-chairs, Dr. Helen Kiari from the Ministry of Health in Kenya, and Dr. Jennifer Rakera from UNICEF, to introduce quickly to the Health Data Collaborative. I'll make some very brief introductory remarks, and then I'll hand over to my fellow co-chairs, who'll say a bit more about the objectives and the achievements of the Health Data Collaborative. It's fitting that they speak more than I do. I joined the World Health Organization in July, so I've only recently taken over as co-chair. Before I do that, I would like to acknowledge the huge contribution made by my colleagues, Dr. Craig Burgess, Dr. Mwenye Kasonde, and Nina Benedicto, who act as secretariat to the Health Data Collaborative. In broad terms, the idea of the Health Data Collaborative is very, very simple. It's to build partnerships across the health sector, the actors and the stakeholders, including academia, civil society, and the private sector. We do this to create better outcomes for countries. The idea is to offer alternative solutions, and we hope also to leverage wider political support, bring in new sources of technical and financial resources. By working in partnership, we hope to reduce the fragmentation and reduce reporting burden to countries. And all of this is to make capacity development in countries more effective. The Health Data Collaborative is data-driven, demand-driven, and this is very important. The work that we do, the priorities that we set, are identified by the countries, our members. So on behalf of the World Health Organization and our many partners at the Health Data Collaborative, I would like to thank the Health Data Forum for this nomination and the recognition of our work. And now it's my great pleasure to hand over to my co-chair and colleague, Dr. Jennifer Rakeo from UNICEF, and she'll give you a brief summary of the Health Data Collaborative objectives. Jennifer.
Thank you so much. I also want to echo the huge thanks to the organizers for the recognition of the Health Data Collaborative and for including us in your program here today. So as my esteemed colleague has mentioned, I'm going to just walk you through the objectives of the Health Data Collaborative and make a few points before I then hand over to Dr. Helen, who will describe some of the country-specific achievements. So as you've already heard, a big focus of the Health Data Collaborative is to strengthen country health information systems. Another main objective is, in order to achieve this, a big focus of the Health Data Collaborative is to align partner resources with country-led data and digital priorities. A third objective is to identify, help produce, and then also adapt tools and other global goods to local contexts, again, with this whole idea of supporting countries and strengthening health information systems. So on that, some of the, just a little bit more in terms of the actual work of the Health Data Collaborative to fulfill or achieve these objectives. As has already been stated, the first priority of the Health Data Collaborative is to focus in on countries and to acknowledge country leadership, recognizing that the strengthening and transformation of health information systems really starts with political leadership within countries, supported by their partners. So it is the express effort of the Health Data Collaborative to work with countries and support the country leadership around health information system strengthening. In terms of the membership, the HDC has grown from 52 members just 2 years ago to about 94. So it's almost doubled in size. And the membership represents around 80 different organizations. So it's a very diverse membership, and it also then provides a great kind of think tank and partnership approach for countries to tap into. So a little bit more on what the Health Data Collaborative does in order to achieve its objectives. A large function of the Health Data Collaborative is to provide a knowledge brokering role. There are several ways through which this is achieved. One is through regular webinars. These webinars provide a platform to inform people about the tools and other kinds of global goods that are available, and provide information to countries and other partners on how they can be used. The Health Data Collaborative also has a newly revamped website where all of these tools and other kinds of materials are made available. And there's also a section there that highlights the Health Data Collaborative priority countries. There are also a set of working groups as the engine of the Health Data Collaborative, and these working groups support the development and dissemination of global public goods and other priority issues to support country health information systems. So some of the working groups, they range from those that are focusing on CRVS to routine health information systems, community health systems, and then also broadly digital health. The Health Data Collaborative also includes representation across all of the major constituencies. And the aim there is to make sure that all of the different constituencies are grouped together in this larger partnership so that there can be really excellent sharing of good practices, and trying to think about how these different constituencies can also align around government priorities. In terms of the coordination, or how another avenue through which the HDC works, is that the HDC purposefully coordinates with other similarly minded global health initiatives, including the SDG GAP. It's the work that the Health Data Collaborative is doing with the SDG GAP is to emphasize the whole issue around data use in countries, with a big focus on improving equity and also primary health care. So those are some of the ways in which we are working together with other initiatives at the global level to support the HDC objectives. We've noted as we've started that a large challenge still remains on getting partners to work collaboratively in countries and align their resources, both financial and technical, with government identified priorities. So that is what we are prioritizing to work on. And that being said, now I'd like to turn over to Dr. Helen Kieri from Kenya, who will describe to you some of the country examples and where we are trying to achieve this goal of getting better alignment at the country level around government priorities in data and digital. Thank you so much again. And now I'd like to turn it over to Dr. Helen.
Okay, thank you, Jennifer, and McFeely for those sentiments. I also want to echo my colleagues for really applauding the meeting organizers, the World Health Economic Forum, for really recognizing the HDC and the work that you're doing to foster data and digital initiatives in terms of really rallying partners to support country priorities. And I also want to recognize the team that we work with at HDC, that is Dr. Mwenya and Craig Burgess, who are really very, very instrumental in terms of achievements at the HDC. So as my colleagues have highlighted, the HDC initiative is extremely key in terms of fostering partners and countries' collaborations in terms of supporting country priorities. And some of the achievements really that have been seen over the years since the launch of the HDC in 2016. For example, in Kenya, we were able to really build capacity of data analytics through some of the immediate priorities that were lined up via the HDC initiative. In the course of a number of years, we have been able to build a data warehouse, which we call the Kenya Health Research Observatory, that really allows multiple data from various sources to be put there, and it can be accessed in one single source. We also have implemented harmonized health facility assessments. As you know, data from health facilities is extremely important in terms of planning, for investments, and also seeing where are the gaps in terms of service delivery in facilities. Previously, we had partners supporting various initiatives in terms of health facility assessments, and through the Health Data Collaborative, and one of the initiatives that was one of the priority initiatives was to harmonize these health facility assessments. And in Kenya, as in many other countries, especially in the African region, we implemented the health facility assessment, as a single source of health facility data, really collapsing a lot of parallel but similar initiatives. In Botswana, a key achievements through the HDC initiatives is aligning or harmonizing health information systems, which were initially about 37 to about 9 now, which of course increases efficiency. As one of the presenters also highlighted earlier, that many systems really are not very, very useful in terms of managing data in a health sector. So those are some of the achievements. There are many others. The countries that are participating in these initiatives really have been increasing over time. I think we started with 4 countries. Right now, we should be at about I can't remember the exact number, I think 12 or 18, but the fact is that many more countries are getting interested in launching their, getting on board the HDC discussion. Amidst this, there are still many challenges that are still, that we still witness around countries in terms of data and digital initiatives. One of the issues is still the issue of system harmonization. We still have many partners supporting separate systems that really do not talk to each other. And these are some of the issues that, we are trying to continually address and see how partners and countries can work together to bring this into really more and more harmonized systems. We have issues of, a lot of indicators being reported, leading to reporting burden when partners maybe are supporting a certain, disease area, especially HIV, malaria, TB. you find that they have parallel data systems that sometimes, the same maybe nurse at a dispensary or a health post somewhere may be required to really see the patient, is a HIV patient, see another malaria patient, and end up doing a lot of filling of reports. So these are some of the issues that are still there in terms of burden of reporting, and also a lot of indicators that are not harmonized. Even within a single country, you may find separate plans, the M&E plan, the strategic plan, and the national plan all have health indicators, but they are not really well harmonized, so that there are still many outstanding issues. We have an issue again of really getting partners on board the HDC discussion in countries, which is why Jennifer has also brought up the issue of political and country leadership engagement, which the HDC has been really supporting and leading. I think we have had so far 2 leadership meetings where a country high-level leadership have come together and really beaten the drums towards really talking to the idea of supporting harmonization of data, investments in data, both financial and technical investments. So let me stop there. But I'm sure you can visit the HDC website, which has additional information on some of the initiatives being led by the HDC. Thank you very much.
Thank you so much, Helen, for these presentations, and the team also well organized. And this is a reality check that we have to have here in this global hybrid summit, because just 3 days ago, it was the UN International Day, a day to celebrate the work of UN. And of course, WHO is part of the United Nations, and an effort of persons that are really thinking about all of us in this planet, all of us. And this is a good reality check to see how the difficulties and of our human fellow companions in this planet have facing in different parts of the world, and challenges that Dr. Helen Carey is facing in Kenya. This is, I call it a reality shower. We have to become really more collaborative, and this effort of the Health Data Collaborative is amazing. Thank you all. A round of applause, and it's really an honor to recognize this work for the whole of us. Okay, last but not least, we are Health Data Forum and have to think about deep tech and health data. So last but not least, Valerie from Neurologic is going to show us, very short, please, and then we have a little bit Q&A before going to the next.
So hi everyone, I'm Valerie and representing Neurologics from Toronto, Canada. Now, as the presentation will come up, I am going to ask you, when you are thinking about your health vitals, right, or risk assessments, most of you, like me, you have to actually get into the car or the bus or the train, actually go and see a nurse, a physician, you stay in the waiting room, you actually have to fill in questionnaires, get tied up to these devices, instruments. What if I tell you that we can actually do this for you in a matter of 30 seconds by simply looking at the camera of your device? Hold on 1 second, it's stuck. Sorry, presentation is stuck. Okay, there you go. So this is Neurologics. We have a software capability that allows you to look at the camera of your device, and we can tell you after 30 seconds merely your health vitals, your systolic and diastolic blood pressure, heart rate, irregular heartbeat, heart rate variability, the risk of the person having a cardiovascular disease, a heart attack, a stroke. That's a 10-year model, and we are working on a 20-year model. We also give you a general wellness assessment. We also have released the health risk factors, metabolic risk. That means, ladies and gentlemen, no instruments, no wearables, because a lot of people around the world do not have the luxury of having these expensive equipments in their house, you can also just look at the camera of your device and you will get the information as to whether you are likely suffering from hypertension, diabetes type 2, hypercholesteremia, and hypertriglyceridemia. And by the end of the year, we will also release the likelihood that your A1C levels could be above or below the clinical cutoff level. So this, as a tool, a very seamless contactless tool that can be in the hands of everybody, will then give you great indication as to whether you could be suffering from some kind of risk. It's also great for preventive care. It's also great for prompting your users to actually seek out a medical physician and to get tested in order not to actually get sick or actually reverse the situation. Now, besides having these particular health vitals today, we are also working on a whole new set of blood biomarkers, which we also going to be releasing by next year, the beginning of next year. So you can see that the blood biomarkers, we are also going to give you indications as to whether the blood glucose is high or low, whether your hemoglobin could be high or low, and mental health is also a serious issue that we talk about openly. So not only do we measure your mental stress level index today, but we can elaborate on that for those that are concerned about the mental health of their users by giving you the likelihood that they could be suffering from anxiety or depression. So this is also another tool that can be helpful when it comes to additional care that you need to attribute them. Now, how does it work? So it's not magic, like some people ask me sometimes. We are looking at your beautiful angelic face, and we've developed the transdermal optical imaging technique. It's called the TOI technique, patented and registered. What we see is actually the blood flow information underneath your translucent skin. So for us, the TOI technique is actually looking at this information across the 17 different points across your face. So it's a wealth of information. The TOI technique actually takes the optical sensors of the camera with the light reflection, and together with our advanced signal processing and machine learning, it actually extracts the blood flow information. It then sends it up to the cloud. We are a cloud-based solution using the AWS cloud. And important to mention that we are totally skin agnostic. It's not about the color of your skin. It's about having adequate light that shines onto your face and allows us to extract the blood flow information. We then send it up to the cloud. We gave a nice branded name, DeepFX, to the cloud. The results are calculated with our effective AI engine on the cloud with by the TOI signal that we've just collected. And the schematics looks like this. You have a segregated data, anonymized, which is then in your siloed account, which you can call the data with API onto your dashboard, but then also return it to the platform, whichever platform you use, whether it's a mobile application, whether it's a web browser version, whether it's a Windows or Linux, we can then be integrated into all of these platforms. So most of you are going to ask, what about the studies and research that's been done? We are giving you medical grade accurate solution. We have done all the studies and research within the medical facilities and university facilities. So we do it at St. Michael's Hospital in Toronto, as well as University of Toronto. But we also have a data collection company in Hangzhou, China, which does collaborations with local hospitals and universities. We are very transparent, and we give you the exact accuracy level of all of the features that you get. So you see that systolic and diastolic blood pressure, 95% accuracy level, exactly what is dictated by the FDA. We also have heart rate at 99%, your stress level index is at 92. The health risk that we just released is about 88, 89%. We're working on improving those models. We also have published papers by the professors using the TOI technique in the prestigious medical journals, so you are free to go into the Neurologics website and then download them and read them. We are constantly working on new platforms. So this is the web browser version. So a lot of companies want to avoid having you download an extra application onto your mobile, but they want to also give you the possibility of having a web browser version, or you can have a hybrid solution for those that have an app or those that just want to go onto the website. And this then will do the exact work that the mobile app works. You just look at the camera of your laptop, your desktop, and in 30 seconds, it takes your vitals and then it presents the whole listing of vitals. Our additional solutions, as you can see here, is a solution that's already been around for research, but we are going to implement it for the telehealth sector. So imagine you're sitting across a telehealth application where you're going to talk to your doctor. Instead of it being just a conversation like we have Zooms today, you can actually click on a link, consent, and the doctor is going to see all of your physiological and psychological states second by second. It's called the continuous monitoring, and then make an assessment as to whether you should be sent over for, blood works, for extra exams, etc. So all of that is really like doing a virtual consultation without having been to tie yourself up to all these, devices and instruments. We are doing away with all of this and giving you just a software component that you integrate into the platform. The insurance sector, insurtech is a big thing. Insurance companies now are also looking at ways that they can do pricing and dynamic underwriting in a very digital manner. So that means that the next time you're going to renew your policy or you want to take out a new policy, you will basically be asked to just look at the camera of your laptop, your mobile. They will then assess the vitals. They will assess the health risk that you pose as a customer, give you the pricing, and then decide as to whether to renew your policy. That will avoid you having to take a trip to the nurse, to the physician to get your vitals. But also, many insurance companies across the world are also giving you incentives. They were giving you rewards for staying healthy. It's a win-win situation, because if you do lifestyle changes, you actually, they have the benefit of not having to pay out these huge amounts afterwards for treatments. So by getting all of the vitals with a lifestyle change program, you can actually get a reward by getting a discount on the next policy, getting a discount at the gym, or going for a nice healthy shake. But it's also a reward for you to keep healthy. So customer use case, it's pretty broad. 60 to 70% of our customers are in the health and wellness sectors. You can see remote monitoring of elderly, how this could be very beneficial for them. You also have the remote monitoring of patients. You have insurance, reinsurance companies, telehealth, obviously, and many different types of products. I mean, the car of the future that you're going to be driving is actually going to take a scan of your vitals, and should, God forbid, something be wrong, they might go in the automatic mode and then drive for you. So there's many different sectors. We are really a game changer in this type of solution. We came out with the application 2 years ago, which the first to actually measure your blood pressure. I do want to mention a very strong partner and collaborator of ours, Bupa, Sanitas, which launched their telehealth solution over a year ago in Spain. And I've also launched with Bupa in different Latin American markets, where you can see that it's a seamless integration. It becomes a one-stop shop, solution, whatever your platform is. In this particular case, it's the, telehealth or the subscriber services for the users. They've integrated the Neurologics software component, and in a matter of 30 seconds, before you consult with the doctor, he actually gets a whole list of information as to what is happening with your vitals. So at Neurologics, very simple. We are trying to, give you, empower you to be healthy, and basically taking a selfie is staying healthy with us. So if you have any further questions later on, I'm reachable at ValerieLastre@neurologics.com.
Thank you so much, Valerie. Whoa, this gives us the spooks. This also gives an indication of how health data can be truly revolutionary, because right now we are thinking on policy making, decision making, thinking on the past, on what we have witnessed so far. And this is interesting presentations that is also our contribution as a global hybrid summit to highlight what is going to happen in, I say, Miguel, where you put a question mark on 220. I don't know, but it's going to happen real soon. Okay, so we are a little bit delayed, and I'm trying to hope that the Starfleet presentations cannot be jeopardized. So perhaps we start the next session with a 10 minutes delay, if that's okay. And Laurie, let's open a round for questions and answers now in order to then release global shapers from the floor and bring the Starfleet presentations that Pedro Cid is going to host in my place. So, floor is open. Laurie, any reactions in Zoom?
Yeah, we did. This was such an exciting panel. It was great contributions. There was a couple of thoughts here from George and Natika, and they asked similar questions. Is there a plan to plug the digital divide in countries like Brazil, and how to ensure a budget to expand virtual first type solutions? So thinking about that whole digital divide in a lot of our countries, and I can say that in Canada, we also have the digital divide in remote areas. So any thoughts on that from the panel?
Steve, go ahead. I saw that you were hesitating.
Just to say, I mean, this is an issue, obviously, for the UN, because the digital divide has created...
Maybe you can closer to the mic, please. Yeah.
The digital divide has also created a data divide. So a lot of the technological solutions where we see pressure to use big data and other data sources, we have to be very, very mindful that in a lot of cases we exclude hard to reach communities. And for the UN, obviously, the motto of leaving no one behind is critical. So this is an issue for modern statistics as we go forward. Thank you.
Good observation, and we have to think more about that. Sure.
Paul, another question that we had was, this was to the last presenter, to Valerie from George. How are you addressing data consent and privacy regarding your data that's collected?
Okay, so we are totally GDPR compliant when it comes to Europe, HIPAA compliant for the Northern America, PIPEDA compliant in Canada, and SOC 2 compliant. So in terms of privacy, we totally have addressed that. You also have to know that we do not have access to any of the data of the users. When we sell the software component to any company that's implementing it in its platform, then the data stays with them in their siloed account, only accessible to them with a license, a key. We don't have access to that data. We are not in the business of collecting data. We do our data collection in a very rigorous manner in the university and clinical environment. But the data belongs to the company, whomever deals with the users that are actually using the platform.
Thank you. Thank you. Is there time for one more comment, Paul?
Please do one more comment, and also in the audience, if anyone has a quick question, we have still time because we're delaying 10 minutes the next session.
I think there was sort of a common theme that's coming up here today, and that's around this whole idea of ecosystem, and this innovation ecosystem. So that seems to be a common theme that's coming. But another thing is that we need to be more collaborative. That there's this idea that we have to break down the silos. And Anzi, you had some comments on that, and I don't know if you wanted to elaborate a bit more on that.
Yeah, thanks, Laurie. I liked your comment and the takeaway, and it seems that, like you said, it's becoming a common theme, not just in this conference. But it seems that what healthcare is observing because of this move to, let's say, new models of care and the need for innovative new solutions is that other areas outside of traditional healthcare settings also need to be connected. It's becoming more and more important that social care or even housing and education play an important role in a wider wellness and well-being state of an individual. And that's, and on one side we have technology. We've seen a lot of innovative solutions. But at the end of the day, the interesting thing is done by community or by a group of experts, some for AI, some to figure out how to do digital transformation. And it seems to be there's always, let's say, 2 or 3 aspects. One is the technology that can drive the innovation further. Then is how do we actually digitize? How do we transform? Because it's a change management. And then I guess there's another aspect, which is data itself, right? How do we make sure that everyone in this wider ecosystem can have, let's say, safe access to data? We really need to bring down these silos and find a way to collaborate where, let's say, healthcare experts or AI enthusiasts, they can build the new innovative decision supports, rules, best practices. And we need a technology environment where we can share that with different solutions. Because if we can get to a point where data and algorithms and knowledge and best practices and pathways can be easily shared, almost like in an executable format, then everyone is just reprogramming the same concepts all over again. It's COVID, I think, showed this really well, because the guidelines were changing or are still changing like on a daily or a weekly level. Someone figures out something new, but it was all distributed on a paper. Imagine if we had this like in a digital format, someone would define it and share it overnight, and we could just plug it into our existing IT solutions where everyone in the morning would be following that through a system. And that's where community comes in, right? So IT companies, we need to do the technology. Community of experts need to do the algorithms, but we need an environment where it all plugs in. And I guess that, if you think about it, all these smart things need data and need standards, because if we all understand the data that we work with, then we can bind algorithms to data, and then technology in a way becomes just the enabler to get all of those concepts up to life, right? So and again, it needs to be done in collaboration for everyone benefit. So the community breaking down of the silos and data is really important, I believe.
Thank you so much.
Thank you.
Paul,
Thank you so
over
much.
to you.
Oh, thank you, Laurie. You did awesome and precious assistance. Great to have a colleague here moderating with me, and in hybrid way and fashion, we are working in tandem. Thank you so much, dear presenters, global shapers, for being here and enriching our lives with your work. Thank you so much. Now, calling here, Peter Freire is going to host the next session, so maybe we can release the auditorium now. And perhaps, Reggie, if you can restart the stream so we can have a separate stream. And just for the specific, because we are already here too many hours. Thank you so much, Zoom. And participants that are arriving now for the next panel, please be advised that we are starting 10 minutes. If you be so kind to take a cup of tea